أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الذي خلقني فهو يهدين والذي هو يطعمني ويسقين وإذا مرضت فهو يشفين والذي يميتني ثم يحيين والذي أطمع أن يغفر لي خطيئتي يوم الدين رب هب لي حكما وألحقني بالصالحين واجعل لي لسان صدق في الآخرين واجعلني من ورثة جنة النعيم صدق الله العظيم.
Assalamu alaikum. A very good morning and warm welcome to all distinguished guests, esteemed speakers, colleagues, and participants. To begin our symposium in the most blessed manner, recitation of Holy Quran by Fatmat Zahia, Medical Officer of Department of Internal Medicine. I am Dr. Amnat Ihsana, Consultant Specialist in Radiology. I am honored to be your Master of Ceremony for this important event, the 6th Annual Breast Cancer Awareness Symposium. And joining with me,
Aminat Naishan Ahmad, Radiography Assistant. The theme for this year's symposium is Every Story is Unique and Every Journey Matters. Today we come together to raise awareness, share knowledge, strengthen our collective efforts in the fight against breast cancer, a disease that touches countless lives but can be conquered through early detection, compassion, and collaboration.
Let's remember that behind every statistics is a story of strength, courage, and compassion. This symposium is not only about science and medicine, but also about the spirit that drives change and saves life. Without further delay, let us commence today's program. To formally inaugurate this symposium, I now invite Dr. Basma Ibrahim Sobir, Chairperson of the Organizing Committee, Senior Consultant Specialist in Radiology, and Head of Department of Radiology, IJMH and Dharmavanta Hospital, to deliver the welcome remarks and opening address. Dr. Basma Ibrahim Sobir.
Thank you. Her Excellency, Madam Sajida Mohammed, First Lady of the Republic of Maldives, Minister of Health, Mr. Abdullah Nazim, CEO of Malay City Group of Hospitals, Mr. Ibrahim Abdul Razak Halim, Director of Healthcare Solutions STO, Ms. Ahmed Newshad, State Minister, Director General of Health Services, Director General HPA, Clinical Directors, Nursing Directors, Heads of Departments, Senior Nurses, esteemed speakers, members from the Cancer Society, distinguished guests, ladies and gentlemen. Assalamu alaikum and a very good morning to all of you. It is my great honor and privilege to welcome you all to the 6th Annual Breast Cancer Symposium, an event devoted to one of the most meaningful causes in modern medicine, our collective efforts against breast cancer. We are especially honored by the presence of the First Lady of the Maldives, Madam Sajida Mohammed, as our chief guest today. Your presence inspires us and strengthens our commitment to this cause. This symposium is organized by the Department of Radiology, IGMH Dharmavantha Hospital, with a collaboration and tremendous effort from the Department of Oncology, Surgery, Pathology, Gynecology, Psychiatry, Anesthesiology, Physiotherapy, and Dietetics. Brings together brilliant minds and compassionate hearts. Together, we form a powerful community, united by knowledge, empathy, and an unyielding determination to improve and deliver the best care to the women in the Maldives. It is this belief that drives me and our entire team to organize this event, to learn, to collaborate, and to move forward, reaching new heights in both diagnosis and treatment. Breast cancer remains the most prevalent and leading cause of cancer-related deaths amongst the Maldivian women. And talking about cancer is never easy. It touches our lives deeply and personally. We are honored to have Dr. Shifan on our team, our one and only oncosurgeon, and Dr. Amru, who fights with us passionately and relentlessly. As a radiologist with a deep passion for breast imaging, I have witnessed the life-changing power of early detection. Finding cancer at the right moment can transform not only the woman's treatment journey, but her entire life, preserving her health, restoring her hope, and protecting her place at the heart of her family. This year's theme, Every Story is Unique, Every Journey Matters, captures the very essence of what we do. Because behind every scan, every surgery, every counseling session, there is a story of courage, resilience, and hope. Today, we are delighted to have 21 speakers who will engage you with a series of presentations covering the comprehensive aspects of breast cancer care, from the latest advances in imaging to new surgical techniques, the advancements of chemotherapy and radiation, pain management, post-mastectomy rehabilitation, and the transformative impact of mindfulness. Each topic reflects our shared commitment to evidence-based practice and innovation, pushing ourselves to the best. Together, let us continue to strengthen our partnerships across specialties, ensuring that every patient receives care that is both effective and compassionate. This year, our Department of Radiology celebrates a proud milestone, the successful performance of our first hook wire localization at IGMH and Dharmavantha Hospital. This achievement marks a leap forward in detecting and treating even the smallest lesions, bringing us closer to our goal of early and accurate diagnosis. As healthcare professionals, we are privileged to be part of these stories, not only through our science and skill, but through our empathy and humanity. I would also like to note a positive outcome from last year's symposium, in which our mental health experts, in collaboration with oncology, have begun and implementing their model of care, still in its early stage, but a remarkable success inspired by this gathering. These are not just technical achievements, they reflect the dedication and teamwork that define who we are. I extend my heartfelt gratitude to Dr. Amnat Nazir, our Clinical Director of Radiology, for her unwavering mentorship and guidance that inspire us every day. My sincere thanks also to our CEO for his visionary leadership and steadfast support. Your commitment has been instrumental in making initiatives like this symposium possible. To our partners, STO, and our supporting institutions, thank you for your collaboration and continuous support. And to my amazing organizing team, the radiology team and the wonderful oncology MOs, this event could not have been delivered without your tireless efforts. Your creativity has certainly exceeded my expectations. Dear participants, as we begin today, we as a team deliver to you science and empathy, knowledge and humanity. May we be inspired not only by innovation, but by the people who give our work its deepest meaning, our patients and their families, whose courage continue to move and motivate us all. Let today's discussions spark new ideas, deepen understanding, open room for research, and renew our commitment to every patient's journey. Because indeed, every story is unique and every journey matters. Thank you, and I wish you all an inspiring and meaningful day. I welcome you all once again.
Thank you, Dr. Basma, for the inspiring opening and for your leadership in organizing this important event. Early detection plays a vital role in improving survival rate and treatment outcomes. This session explores how modern screening methods helps to detect breast cancer at its earliest stage and why it is important. Please welcome to the stage our keynote lecturer, Dr. Afla Sohail, consultant specialist in radiology at IGMH and Dharmavanta Hospital, to share her expertise and insights on this important subject. Dr. Afla Sohail.
Her Excellency, the First Lady of the Maldives, distinguished guests, respected colleagues, and dear participants, a very good morning to you all. It is truly an honor and privilege to stand before you today at this important symposium on breast cancer. As a radiologist in IGMH, I have had privilege of witnessing both the challenges and also the triumphs that come with breast cancer diagnosis. Today, I would like to take you behind the scenes to show you how radiology plays a vital role in detecting breast cancer early, often before a woman can even feel a lump, and how our work at IGMH contributes to saving lives across our islands. Breast cancer remains the most common cancer among women in the Maldives and also worldwide. Yet, the story doesn't have to end in tragedy. When detected early, breast cancer is highly treatable and survival rates can exceed up to 90%. Early detection gives women choices in treatment, choices in preserving their body, and most importantly, the chance for a longer, healthier life. And this is where radiology comes in. It is the invisible eye that sees what cannot be felt and reveals what cannot yet be seen. At IGMH, our radiology team works tirelessly every day, performing mammograms, breast ultrasounds, and MRI scans, helping clinicians detect disease in its earliest stages. We have very skilled team of radiographers who play an essential role in delivering accurate and compassionate imaging services. Radiology is at the heart of early detection. It begins with screening, where we use imaging to look for early, subtle changes long before the symptoms appear. Let me walk you through how each of the tools we use and how they are so essential. Coming to mammography, which is our first line, mammography is the gold standard for screening. It detects the importance of mammography is because especially it detects tiny calcifications, sometimes just a few millimeters wide, that can be the very first sign of cancer. Here you can see an image of a mammogram where I have zoomed in and there are calcifications which are suspicious for this patient had undergone further assessments and was diagnosed with cancer. The images you see here are mammograms from patients. On the first one shows benign calcifications. Through mammogram, with the help of it, we can differentiate benign and suspicious calcifications and take actions accordingly. The second image, you can see there is a visible mass seen in white color delineated clearly in the mammogram. Ultrasound is our second key tool. It is safe, it is radiation free, and it is ideal for dense breast tissue, especially useful for younger women with dense breast tissue, which is common among Maldivian women. It detects lesions missed on mammogram. It can be tailored for scanning, focusing on specific areas, and there is real-time assessment and patient reassurance. I am very pleased to say that IGMH is the only institution in the country where we practice same-day mammogram ultrasound correlation, which meaning that any area of concern on mammogram is immediately assessed with ultrasound by the same radiologist, and both the findings are included in one report. This ensures accuracy and consistency for our patients. I'm right now showing you images of ultrasound of a patient who has a suspicious looking mass. The first image shows the mass. This is a patient under 35 who cannot undergo mammogram, and so went for USG ultrasound screening, and there was a mass detected, and we did biopsy for this patient, and it came out positive for cancer. Sometimes ultrasound helps us to reassure a patient from whether the lump is benign or not, sparing her from unnecessary anxiety and invasive tests. The next tool is MRI. This is usually used for high-risk women. For high-risk women, such as those with strong family history or previous cancer, we take MRIs. And MRI breast can detect cancers hidden behind dense tissue and help us guide surgeons in planning precise breast-conserving operations. These are some of the advanced techniques we use. You can see that we use contrast kinetics to characterize the lesions. Coming to advances in screening technologies, we have digital mammography and tomosynthesis. These are particularly useful in dense breast. Digital mammography was started in IGMH in 2017, and tomosynthesis was started in 2019. These are 3D reconstructed images with reduced overlapping tissues. So basically it allows better margin assessment of the masses and also architectural distortion surrounding the masses. This is now a routine tool in breast cancer screening at our center. Contrast enhanced mammography is something we do not have yet in IGMH. We hope to get in a very near future. This is digital mammography with iodinated contrast. It produces recombined images highlighting areas of contrast uptake. It is used for lesion characterization, extent of disease evaluation, and particularly helpful in dense breast when MRI is unavailable or when it is contraindicated. You can see these two images, where the first image is the conventional mammography, and where the lesion is not clearly seen, and then we have the second image shows contrast enhanced mammography, where you can clearly see the lesion and appreciate its characteristics and see whether it is benign or malignant. The automated breast ultrasound system is also something which we do not have in the Maldives yet, but we hope to have it in the future. This plays a complementary role. It is well suited for our outreach screening programs in the islands. This is automated system which will be performed by technologists. So the images could be saved in cloud systems or picture archiving communication systems or PAC systems, and the radiologist can batch read images remotely. This will be very useful for our islands, especially for outreach programs. Though we have come far in MRI, we still have some advances which we haven't got yet inshallah, in the future we will have abbreviated breast MRI, which is a shorter 5 to 10 minute protocols we do only for breast cancer screening. Yeah, it is, and we also have hybrid imaging where we use PET and MRI hybrid, both combined to delineate and detect lesions. And we also have AI-assisted MRI analysis. It is used to highlight suspicious enhancement patterns and also actually quantify the enhancement amount in the lesion. So the rise of artificial intelligence has raised concerns that one day that it will take over radiology and radiologists, but that is far from truth, because we should not take it as a replacement, rather a tool which helps us guide and which helps us do better and proper diagnosis with confidence. This is where our imaging is headed with AI, and also we hope to have molecular imaging, AI for predictive modeling, and context-specific screening protocols, which is going to further enhance our imaging techniques. Early detection saves lives and resources. Beyond the images and reports, every scan tells a human story: a mother, a sister, a daughter, and a friend. Before I end, I would like to share with you a story of one of my patients who I met not very long ago. She was a 33-year-old who came in very hesitantly for an ultrasound scan. Her mother had passed away in breast cancer a few years earlier, and she told me that her mother had known that something was wrong, but still the fear of diagnosis, fear of treatment, and especially the fear of losing her breast kept her away from reaching out. Sadly, that fear took her life, and she succumbed to cancer. But her daughter made a different choice. She decided to face her fears and come forward. Her scan revealed an early stage 1 breast cancer, which was detected in time, which was treatable and with excellent prognosis. She is currently cancer-free. Stories like hers remind us how far we have come. With better awareness, compassionate care, and early detection, fear no longer has to cost lives. And that is the real progress we strive for every day. Thank you.
Thank you, Dr. Afla Suhail, for the insightful presentation emphasizing the critical importance of early screening. Up next, we will hear about how diagnostic tools from scan and guided biopsies to hookwire localization have advanced over time. Please welcome to the stage Dr. Mariam Muzna Muhammad, Consultant Specialist in Radiology at IGMH and Dharmavanta Hospital, to share her knowledge and valuable insights. Dr. Mariam Muzna Muhammad.
Bismillahirrahmanirrahim. Her Excellency First Lady Madam Sajida Mohammed, Honorable Minister of Health Mr. Abdullah Nazim Ibrahim, distinguished guests and esteemed colleagues, Assalamu alaikum. It is a privilege to address you today on a topic that sits at the heart of patient outcomes in breast cancer: ultrasound-guided interventions, from scans, ultrasound-guided biopsies to hookwire localization. A journey through the role of ultrasound and radiology at every stage, from early detection, diagnosis to management of lesions. Breast cancer is the most common cancer amongst women worldwide, accounting for about 1 in 8 female cancers diagnosed. According to WHO, over 2.3 million women are diagnosed with breast cancer each year. The incidence is increasing,
particularly in developing countries such as ours due to changes in lifestyle, diet, and reproductive patterns. The first and most powerful step in changing the trajectory of a patient's journey in breast cancer is early detection. By identifying cancers before they advance, we open doors to less invasive therapies, improved survival, and crucially, preserved life. At the center of this progress is ultrasound imaging. Why does ultrasound matter? It offers real-time, high-resolution imaging without radiation exposure. It is particularly valuable in individuals with dense breast tissue where mammography alone may miss a pathology. Ultrasound complements other modalities such as mammography and MRI, enabling a comprehensive assessment when a lesion is suspected. Importantly, ultrasound is not a replacement for other imaging modalities, but a critical partner that enhances our diagnostic confidence and guides subsequent management. Beyond simply detecting lesions, ultrasound plays a pivotal role in characterizing them. We evaluate and look for certain features in the lesion. Based on these findings, we classify the lesions according to Birad's classification, which informs whether we should closely monitor a lesion, biopsy, or let the patient go into annual screening. Accurate characterization is the essential first step towards appropriate treatment planning. Here we have an example. On the left, we have a very well-defined round lesion. This is an example of a benign or non-cancerous lesion. On the right side, we have a very ill-defined, irregular lesion. This is an example of a cancerous or malignant lesion. When imaging points towards suspicious features, ultrasound-guided interventions becomes indispensable. These interventions are indicated for palpable or non-palpable suspicious lesions, lesions that show indeterminate ultrasound findings, or for preoperative localization, such as hook wire localization, which I will look into later. They are also useful for fluid aspiration from cysts, essentially any lesion that needs precise targeting is a candidate. This precision translates into better diagnostic yield and safer, more effective care. Ultrasound-guided interventions include ultrasound-guided core needle biopsy, fine needle aspiration, vacuum-assisted biopsy, and hook wire localization. First, let's look at core needle biopsy. This is the gold standard for obtaining tissues for histopathological diagnosis. This is how we perform an ultrasound-guided core needle biopsy. Under direct ultrasound visualizations, we accurately place the biopsy needle within the lesion and obtain tissues. These tissue samples are sent for the pathology team for assessment. Ultrasound offers real-time visualization of the lesion, allowing us to avoid any blood vessels and further complications. It is minimally invasive, leaving only a less than 1 centimeter cut on the patient. It offers a high degree of accuracy. Next, let's look at fine needle aspiration cytology. FNAC is a much simpler, faster procedure where we aspirate cells with a small thin needle. It is especially useful for cysts or suspicious lymph nodes, which, while it gives cytological or cellular information, it cannot always provide detailed tissue architecture like a core biopsy, so it's often complementary rather than a replacement. So this is how we perform FNAC, a small needle such as that which is used for blood sample aspiration. We insert the needle into the cyst or lymph node and come out with cells or fluid. Next, let's move on to hook wire localization biopsy. It's a novel pre-surgical localization technique done for non-palpable lesions that needs surgical excisions. It's a technique where a wire with a hook at its tip is inserted into the breast lesion, which allows the surgeon to precisely target the area. Again, under direct ultrasound guidance, we insert the hook wire into the lesion. One end of the hook will be left outside the patient, after which the patient will be transferred to the surgeon. Now the wire acts as a target and guides the surgeon to excise the lesion. Following excision, we scan the specimen to ensure that the entire suspicious area has been removed. It's a simple yet highly effective method for guiding lumpectomies or excisions. Hook wire localization biopsy enables removal of tiny, impalpable lesions that can't be felt or seen during surgery. This improves accuracy and surgical outcomes. It reduces re-excision rates by ensuring the correct area is removed. It avoids unnecessary large resections. We are delighted to highlight that IGMH achieved a major milestone by performing its first hook wire localization this year, July. This was done in collaboration with the surgical team. This represents a significant leap towards breast cancer imaging and surgical precision. It also reflects the hospital's commitment to achieving women's health and early cancer detection. This is our team at work performing a hook wire localization. This is the wire we use for the hook wire localization. Let's look at a case. This is a 45-year-old female where we noticed a suspicious lesion on ultrasound. The image shows a cyst. Adjacent to the cyst, this is a dilated duct. Within the duct, there are calcifications and inspissated secretions. We performed ultrasound-guided core needle biopsy for this lesion. The histopathological diagnosis came as breast papilloma with sclerosing adenosis. Now, this is not a cancerous lesion. However, sclerosing adenosis is surgically managed by excision to rule out malignancy. This was not a palpable lesion. Therefore, we moved on to hook wire localization biopsy. Here you can see the lesion, and that's the wire within the lesion. After inserting the hook wire, the patient was sent to the surgical team, and the lesion was taken out. After which, this is an ultrasound on the specimen where you can see the lesion and the hook wire has been taken out. The final histopathology for this lesion was complex sclerosing lesion or radial scar. Very fortunately, this is not a cancerous diagnosis. However, we have managed to give the best surgical treatment management for this patient. Ultrasound is indispensable at every stage of breast cancer care, from earliest detection to most precise localization before surgery. Imaging informs decisions, steers management, and ultimately improves patient outcome. Our clinical imperative is to continue integrating these technologies, advancing accuracies, expanding access, and refining technologies to ensure every woman receives timely, precise, and compassionate care. Together, let us continue to advocate for early detection and strive for a future where breast cancer can be managed more effectively and compassionately. Thank you all for your attention and your unwavering commitment to this important cause.
Thank you, Dr. Mariam Muzna Muhammad, for the comprehensive and enlightening session. We now move to an important topic, a challenging topic as well, navigating fertility and breast cancer diagnosis. Please welcome Dr. Fatmat Shazma Ramiz, consultant in obstetric and gynecology, National Fertility Center at IGMH and Dharmavanta Hospital. Dr. Fatmat Shazma Ramiz.
Bismillahirrahmanirrahim. Her Excellency Madam Sajida Mohammed, Honorable Minister of Health Abdullah Nazim Ibrahim, distinguished guests, and my dear colleagues, a very good morning to all. It's my honor to be here today as a part of this event and speak on a topic which is very important and which also beautifully bridges both oncology and reproductive medicine at the same time. For many young women, breast cancer diagnosis is not only threatening their life, but it also disrupts their dreams, the dreams of family, dreams of motherhood, and also their future and dreams that they have envisioned. Most of the time, in the shock of diagnosis and the urgency in treatment decisions, the question of their fertility is lost somewhere. So today I would like to highlight on the importance of considering the fertility options in these patients. So why is it a concern? Why is it a matter of concern? Most malignancy, as we know, most malignancy among reproductive women is breast cancer, which accounts to 10 to 15% of under 45 years of age. And today, the survival rates are improving due to early detection and advanced therapy. So the 5-year survival rate has increased up to 85 to 90%. This shifts our focus of survival from our focus of survival to survivorship as well, which also includes fertility preservation. So how does the treatment of breast cancer impacts on fertility? The treatment includes both chemotherapy, radiation therapy, as well as endocrine therapy. And we all know that chemotherapy and radiation has a very big effect on pregnancy. It has the risk of congenital defects and also spontaneous miscarriages. So having a pregnancy during the treatment is not an option, and also at the same time it decreases the fertility rate in these patients. Coming to chemotherapy, the most commonly used drug in chemotherapy is cyclophosphamide, which reduces the ovarian function and results in premature ovarian insufficiency in our patients. And also it can cause temporary menopause in young women, and also sometimes permanent menopause in patients who are elder than 30 years old. Now coming to radiation therapy also damages ovarian follicles and other reproductive organs. And finally, endocrine therapy, the most commonly used drug, tamoxifen, is also contraindicated in pregnancy, and it also is advised to stop tamoxifen at least 3 months prior to conceiving because of its effects. Not just that, it also delays the conception in these patients. So saving a woman's life is our first duty, but helping her reclaim her dreams is our shared responsibility. So a holistic approach in the management of these patients and a collaborative management between different disciplines, including oncology and reproductive medicine, is very important. Undoubtedly, the top priority is managing and treating the cancer patients, and therefore physicians and patients themselves may be very hesitant to delay the treatment for any reason, and there is certainly potential delays while referrals are placed and fertility preservation options are explored. Also, physicians hesitate to introduce this topic to the patients that may add stress to a patient's already critical situation. But however, a multidisciplinary team approach is essential, which includes oncology, fertility specialists, and psychologists also for a comprehensive care of our patients. and therefore establishing a timely referral pathways to fertility preservation options is very critical. Now, coming to the most important part of my presentation, I'd like to talk about fertility preservation options. We have several options, and the most commonly accepted options are oocyte cryopreservation and embryo cryopreservation. In oocyte cryopreservation, the ovaries are stimulated and oocytes are harvested and frozen without fertilization for future use after their treatment. The success rate is around 36 to 61%, and it is already a well-established method. The second is embryo cryopreservation. It's another option where ovaries are stimulated, oocytes are harvested and fertilized in vitro before cryopreservation. The success rate is a bit lower than the prior, which is 25 to 40%. However, it's also a well-established method. Next is ovarian tissue cryopreservation, which is also an option where surgically obtained ovarian tissue is cryopreserved, then reimplanted later after their treatment. Success rate is about 40%. This is an innovative method, but yet not established. And before we think of this option, we have to also consider the fertility chances in those patients. It's important to assess their AMH levels and also their antral follicle counts before going for this option. Other methods include in vitro maturation of oocytes, where the immature oocytes are isolated from the ovarian tissue and maturation of them in vitro. This is also an experimental method yet. However, over 5,000 children have been born from in vitro maturation of oocytes so far. The other option is ovarian transposition. This means transfixation of the ovary outside the radiation field. This reduces the radiation to 5 to 10% of expected dose. And then comes the drug option, GNR agonist. By using GNR agonist, we can temporarily shut down the ovary or suppress the function of ovary to protect the immature follicles during the treatment period. This is also an experimental method and not established yet. Now, talking about the barriers to access fertility preservation. Of course, there is very much limited public awareness yet on this topic, and it's very important to make the public aware that we have these options before they start their treatment. And then comes the time constraints. The time is very important for every cancer patient because the more we lose the time, the disease advances. And then comes poor coordination between oncology and fertility services, which leads to low referral rates, which we can hopefully improve. Finally, the financial burden. Of course, fertility treatments and also cancer treatments are a big financial burden for the patients. The key takeaways: fertility is a survivorship issue, and every patient deserves informed choices before their treatment. Early counseling and multidisciplinary referral is essential. Safe and effective fertility preservation is a feasible option. And hope and motherhood after breast cancer are achievable realities today. Before I wrap up my presentation, I am happy and very proud to announce that today we have our own National Fertility Center, which is providing the services, and also the gold standard methods that I have mentioned in my presentation, oocyte preservation and embryo preservation. These are already established services that we are providing to our patients. We have already by date cryopreserved almost 300 embryos, and not only embryos and oocytes, we also have cryopreserved sperms for female patients who are undergoing cancer treatments as well. So I hope our service is more extended in future, and our collaboration will be better with the oncologists as well. Thank you.
Thank you, Dr. Fatmat Shazma Ramiz, for the thoughtful and compassionate talk. Emotional well-being is as important as physical healing. This session introduces the distress thermometer. Please welcome to the stage Fatmat Sophia Rashid, lead social worker at the National Center for Mental Health. Fatmat Sophia Rashid.
We have 1 minute. Thank you for having me. Assalamu alaikum, everybody, and a very good morning to you all. Today, I will talk about what we have been doing in collaboration with Oncology Department and National Center for Mental Health. Since until Shafaq gets ready, the three speakers before me, you have heard saying things like fear, shock. What else? What else did they say? Expensive, financial burden, words like this. We all know that cancer journey can be very distressing. Throughout oh, thank God. Thank you. So the whole journey can be very distressing, from the initial diagnosis to decision making, treatment, and survivorship. So distress is multifactorial. It can be social, spiritual, psychological, and these are distress is unpleasant experiences that can cause us, may affect our ability to cope and may compliant with the treatment. It is a continuum, so it starts with normal feelings of vulnerability, sadness, and fear to more complex issues such as depression, anxiety, and existential crisis. Research shows that 25 to 60% cancer patients reports distress, and of course all are of risk of distress, but some of them have more distress. Mainly identified groups are females, younger people, single people compared to married people, and when they come across specific cancers like breast cancer and thank you, breast cancer and brain and pancreas. So high level of distress, why is distress important? High level of distress affects the ability to complete cancer treatment, alter quality of life, and impact overall health outcomes. Like Dr. Basma mentioned, last year the symposium, Dr. Afi presented in this symposium, and we started this journey of with oncology department about early intervention and figuring out what could be done to assess this in Maldives. So some of our initial ideas were conducting training, developing an SOP, and a referral pathway, developing a resource package which could help patients, and research. So this is the NCC and distress thermometer, National Comprehensive Cancer Network. So it was first created in 1997. This has been translated into more than 46 languages. Why we chose the distress thermometer? It takes around 2 minutes 20 seconds to complete the distress thermometer, and as you can see, it first starts with the thermometer itself, identifying where you are at, and then me identifying why this distress is causing. Some of the causes are practical problems, family problems, emotional problems, and physical patterns. So the NCCN guideline request us to follow these 5 steps. So screening, they recommend that all patients should be screened, especially at different points like remission, reoccurrence, and evaluating. So once we do the screening, we can find out what sort of support is required for the patient, and we can start working on those. And if we can also do further assessments like using PHQ-9 and DAS-7 to assess anxiety and depression level. And then comes early referral to appropriate agencies, follow-up and documentation. Just going back, going to this. During our discussion, what we have tried is this step care model. So we have developed resource package for patients so that they can, at the base level, they can do their own self-care, and then developing onto severe and complex issues, so referral can be sent to NCMH. So these are the things that we have been able to do since last year, October. We have completed training for oncology department staff. We have launched a video of our collaboration. We have translated this distress thermometer, and we have done preliminary assessment pilot of this tool. SOP has been developed and is in discussion with the QID. So the preliminary results of the distress thermometer shows that more indicated that there may anxiety and worry, relationship with friends affected most, pain and sleep, tiredness was affected. So it's at the very initial stage. I would say we have a lot more to cover, and hopefully next year's symposium we would be able to show some good quality results and research data. Just like we assess vital signs for patients, we should be assessing distress as the 6th vital sign. Thank you.
Thank you, Fatmat Sophia Rashid, for highlighting the essential role of mental health in cancer care. It is now our distinct honor to invite the First Lady of the Republic of Maldives, Her Excellency Madam Sajida Mohammed, to deliver her remarks. First Lady Madam Sajida Mohammed.
Sorry, get all going to get ad.
Bismillahirrahmanirrahim. Minister of Health, Abdullah Nazim Ibrahim, Chief Executive Officer of Mali City Group of Hospitals, Ibrahim Abdurrazzaq Halim, distinguished doctors, nurses, and healthcare workers, survivors, and their families, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuhu. A very good morning to you all. Before I proceed to my speech, I would like to thank all the speakers who previously talked here and for their invaluable sessions. They have provided a lot of information today. It's very insightful, and I really appreciate the work that you have been doing here. Thank you. It gives me immense pleasure to be here today at this symposium once again as we inaugurate the 6th Annual Breast Cancer Awareness Symposium, a gathering that brings together hearts, minds, and hands for a cause that touches every family in our nation. This is more than a medical event. It is a moment of hope and solidarity, a reminder that behind every statistic, there is a story. Behind every diagnosis, there is a woman, a mother, a sister, a daughter, whose courage reminds us what hope truly means. There are few words that can comfort someone who has just heard the words, "You have cancer." But there are actions that can. The action of catching it early, the action of standing together, the action of making sure no woman feels alone in her fight. Every woman deserves that chance, the chance to survive, to heal, to live, and that chance begins with awareness. If there's one message I wish everyone to take home from today's gathering is simple yet powerful. We must all carry one simple truth in our hearts. Early detection saves lives. Breast cancer, when found early, can often be treated successfully. It is not a sentence of despair. It is a call to act, and to act in time. Every woman must now know her own body, to perform self-examinations regularly, and to seek medical attention if she notices any change. And as doctors remind us, women aged 40 and above should undergo an annual mammogram, even if they feel perfectly healthy. Between screening, stay alert, stay informed, stay hopeful, because screening is not an act of fear. It is an act of love, love for oneself, love for one's family, and love for life itself. To every woman listening today, I humbly say, your health is not a burden, it is your right. And to every man, every family member and friend, I humbly request your support, your understanding, and your encouragement matter more than you can imagine. I wish to take a moment to recognize the extraordinary dedication of the Ministry of Health and Indira Gandhi Memorial Hospital, especially to all healthcare workers who support cancer patients every day. For more than a decade, your leadership has been the driving force behind this awareness initiative, inspiring thousands of women to take charge of their health and saving countless lives through early detection. Through your commitment, the conversation around breast cancer in our country has changed. You have given this issue a voice, a platform, and a purpose. On behalf of all Maldivians, especially as a woman, I extend my heartfelt appreciation. Please know that you have my full and unwavering support in continuing this noble work. One of the most important changes in our healthcare system has been the shift towards a multidisciplinary approach to cancer treatment. Today, our patients receive more than just medical treatment. They receive comprehensive care
from mental health professionals, dietitians, physiotherapists, and palliative care teams, all working hand in hand with surgeons and oncologists. This holistic approach has transformed lives. It has improved outcomes, reduced suffering, and made every patient's journey a little less painful and a little more hopeful. When we treat patients with compassion, coordination, and respect, we do more than heal their bodies. We heal their spirits too. I'm deeply encouraged by the remarkable progress achieved by our radiologists and medical teams. Over the past few years, ultrasound-guided biopsies have become routine. And most recently, IGMH has reached an important milestone, the successful introduction hook wire localization for impalpable breast lesions. These advances are not just technical achievements, they are acts of hope, ensuring early diagnosis, more accurate treatment, and better chances for recovery. Every improvement in medical care represents one more life saved, one more family kept whole, and one more reason to believe in the power of progress. Yet, as we celebrate how far we have come, we must also acknowledge how far we still have to go. We continue to face challenges. The lack of radiotherapy and PET scans facilities, the need for specialized training in nuclear medicine and oncology, and the limited access to advanced diagnostics such as immunohistochemistry and genetic testing. These are not just medical needs, they are human needs, because behind every delay in diagnosis or treatment, there is a person waiting, a family hoping, and sometimes a loved one that we lose. We must also strengthen our capacity for pain management and ensure better access to essential medicines and technologies. My hope for the future is that every woman in the Maldives will have access to the highest quality care right here at home, including stereotactic and MRI-guided biopsy services for precise and early detection. This is the future we must build together. The theme for this year's symposium, every patient's story is unique, every patient's journey matters, captures the very essence of what we stand for. Because no two journeys are ever the same. Each woman walks her own path, some in quiet strength, some in tears, some in faith. But every journey matters. Breast cancer does not define a woman. Her courage, her hope, her resilience, these define her. To every survivor here today, your courage inspires us all. You remind us that strength is not the absence of fear, but the ability to rise above it. And to every family who has lost a loved one, your memory continues to guide us. Your loss strengthens our resolve to do better, to detect earlier, to care deeper, and to never give up. Ladies and gentlemen, breast cancer awareness cannot end with this symposium, nor can it be defined to 1 month to the calendar. It must live on in our homes, in our schools, in our workplaces, and in our hearts. Let us nurture a culture where women prioritize their health, where men support and encourage them, and where communities stand together, understanding and compassion. Let us build a Maldives where early diagnosis is the norm, treatment is accessible to all, and no woman has to face breast cancer alone. This is not just the responsibility of the hospitals, of all government. It is a shared duty, a national mission that calls upon each of us to act with empathy, with awareness, and with unity. Before I conclude, I wish to express my deepest gratitude to the organizers of this symposium, to the doctors, nurses, and volunteers who dedicated their lives to helping others, and to the survivors and families who embody courage, faith, and hope. You are the true heroes of this journey. Your stories remind us that awareness works, that treatment saves, and that compassion heals. May this symposium strengthen our collective resolve to protect every woman's health, to honor every woman's story, and to ensure that every patient in the Maldives receives the care she deserves. Because indeed, every patient's story is unique, every patient journey matters. Thank you.
Thank you, First Lady, for your gracious words and for your continued support towards women's health and empowerment. To express our gratitude to all who made this morning session possible, I now invite Dr. Fatmat Mufliha, Senior Consultant Specialist in Radiology and Co-Chair of the Organizing Committee at IGMH and Dharmavanta Hospital, for the vote of thanks. Dr. Fatmat Mufliha.
Thank you. Bismillahirrahmanirrahim. Assalamu alaikum. Her Excellency Madam Sajida Mohammed, the First Lady of Republic of Maldives, Minister of Health, Mr. Abdullah Nazim Ibrahim, CEO of Mali Group of Hospitals, Mr. Ibrahim Abdul Razak Halim, Deputy CEO, Mr. Mohammad Mabruk, Director of Health Solutions, STO, Mr. Ahmad Nushad, State Minister, Director General of Health Services, HPA, Clinical Directors, Head of Departments, and Nursing Directors, Senior Nurses, esteemed speakers, and distinguished guests, ladies and gentlemen. It is indeed a great honor and pleasure to deliver the vote of thanks at the closing of inspiring inaugural session of our 6th annual Breast Cancer Awareness Symposium. On behalf of the organizing committee, I extend our heartfelt gratitude to our respected chief guest for gracing this occasion, Madam Sajida Mohammed, Her Excellency, the First Lady of Republic of Maldives. On this occasion, with your presence, for your continued support towards advancing cancer awareness and the care in the Maldives. Thank you very much. Our sincere appreciation also goes to Minister of Health for its Ministry of Health for its guidance and commitment to strengthening cancer services across the nation, and to our very own CEO of Mali City Group of Hospitals, Mr. Ibrahim Abdul Razak Halim, for his constant encouragement and leadership that continue to drive excellence in patient care and professional development. Thank you. A heartfelt thank you as well to our Director of Radiology, Dr. Amnat Nazir, our HOD, Dr. Basma Ibrahim Sobrir, whose vision and unwavering support have been instrumental in organizing this symposium and in promoting continuous education within our radiology community. Thank you very much. A special note of appreciation goes to all our distinguished speakers for your valuable knowledge and experience with us. Your insights have not only enlightened us, but also reminded us of our shared responsibility in improving women's health outcome. I also wish to sincerely thank STO and AstraZeneca for their generous support in making the event possible. The dedicated teams of IGMH and Dharmavanta Hospital for their tireless efforts behind the scenes. Thank you. Finally, to everyone present here,
clinical nurses, directors, allied health professions, and students, thank you for your active participation and dedication. Your presence reflects the strength of our shared commitment towards early detection, compassionate care, and continuous learning in the fight against breast cancer. May this symposium continue to serve as a platform that inspires collaboration, compassion, and positive change. I would like to say something in Divahi, a small short poem I wrote. Kadatu kurung eha tatina maves mita, kadatu kurung eku eki mita, mitibi mita, fas nujehi kurimati lama, bastakung ivigem mida mita. Fan savis balama feshung, iltimas kura mita, fan nuveri sihi ehi tering, wame eku eki mita. Thank you all once again, and I wish you a fruitful and engaging day ahead. Every story is unique. Every journey matters. Thank you very much. Have a nice day.
Thank you, Dr. Fatmat Mufliha. So now we have come to an end for the official agenda.